Welcome, my name's Ange. I'm one of the midwives at Ballarat Health Services, and I'm just going to give you a little segment on your pain relief options for labour. So first of all, we're going to look at non-medical options that you've got. And I'm assuming you've already seen our segment on normal labour and birth. So we'll move straight on to non-medical. So probably the most important thing or person to help you with that pain relief in labour is a support person that you really trust and are happy to be in the room with you. Certainly being active and upright is really important. That will shorten your labour if you are moving around and letting gravity help you out there. So we really encourage you to be active and upright. Water is always fabulous as well for labour, and we know that people that use water have a lower epidural rate as well. So being in the shower, we have a bath upstairs. We don't do water birth at Ballarat Health Services yet, but we do have showers available. So certainly that's fabulous. We have one or two Bluetooth speakers, but you're welcome to bring in your own and your playlist, and whatever music is going to help you to be relaxed. Heat packs are also helpful. You'll need to bring in your own heat pack, and we have a designated microwave on the birth suite where you can heat that up, and your support person is responsible for that. We need you to be careful with the wheat packs because sometimes women hold them on and you can burn easily if the support person has made that too hot. So just be careful with that one. Breathing is a huge part of your labour, okay? Your labour pains are like waves. The most they'll ever last is about a minute. So if you can just breathe through, then you're fine until the next one, okay? And really important to just try and relax and go with the contraction. We also recommend too that if you can afford to do a hypnobirthing or a calm birth course as well, a lot of people find them really helpful for mental preparation and positive affirmations as well. Aromatherapy is something some people like to bring in their oils. We have some diffusers upstairs as well, and certainly if that's something that you find really helpful, then that's available as well. And now for medical options that you have for dealing with labour pain. We've got a couple of non-drug options, the TENS machine and water injections. And then your drug options are your nitrous oxide, gas, morphine, remifentanil and epidural. So we'll just go quickly through those. I guess the main thing you want to know is what's going to affect the baby and what's not. So we'll start with TENS. So a TENS machine is trans electrical nerve stimulation, and that's a little machine that has some pads on your back, and you need to book into physio quite early on and have a session with them if you want that. Although some people have bought a TENS machine from a retail shop and have bought that in as well. And the idea is that it creates a distraction, so it gives you a little nerve impulse, and the way that your brain receives feedback with pain, it creates a diversion. So some people find that really helpful. It doesn't affect your baby, and it can be really good at home as well before you come in. The other thing that's really helpful for back pain are sterile water injections. And we would locate your sacral dimples on your back and put about 1/2 ml of sterile water just under the skin in those 4 areas. So there would be 2 midwives doing this at the same time. And that stings like heck for about 30 seconds, but then it often really works a treat. So that's definitely something to keep in mind if you're experiencing a lot of back pain in labour. And then moving on to your drug options, we've got your gas. So you'll see a gas machine when you look at the tour link. of our antenatal education, but the gas is like a breathing piece like this, connected to nitrous and oxygen. And so as soon as you get a contraction, you breathe in, and then you breathe out into the pipe as well. And it just helps take the edge off. It just goes very quickly in and out of your system, doesn't affect your baby, can really help you get on top of your breathing, and just takes the edge off. So I guess it's worth saying too that we tend to not ask you about pain relief. We often say you need to let us know if you feel like you need something, and we really encourage you to push yourself as much as you can, because you'll have your hormones helping you out, and you'll sort of get into the rhythm of things as well. But if you're getting to the point where you're feeling like you would really need something, you let us know, and then we'd normally start with the gas. The thing that you might find is it makes you feel like a little bit lightheaded or dizzy. So if you're sitting on a ball or moving around and using the gas, just have your support person handy, just so that you're not, if you do feel dizzy, you're not going to fall over. Another option is an intramuscular injection or a subcuticular injection of morphine, usually into your leg as well. So morphine's a narcotic analgesic, so it's going to make you sleepy, but it can just help you relax a bit, especially if someone's getting really tensed up and just not coping. Sometimes the morphine will just help you to relax a little bit and get a little bit of rest. Something that we might need to do, and we can't do this without your consent of course, is we might like to do a vaginal examination just to see how dilated you are, because if you're basically just ready to push the baby out, it can be quite dangerous to give morphine, and if you're in premature labour, it's quite dangerous to give morphine, because we know that we're probably going to need to resuscitate your baby. So we want to make sure it's not too close to you giving birth, ideally not within 3 hours of birth, and not for preemie babies for morphine. If it did happen that it looked like you were going to birth quicker than we thought, we would get paediatrics to the birth as well, in case Bugs needs a hand. So a 1 in 5 chance that your baby may need some resuscitation with morphine, but it can be really useful just to give you a little bit of a rest. Sometimes with gas and morphine too, different women might find that they start to feel a little bit sick as well, so we can give you something for nausea if that happens as well. Remifentanil, that's a stronger narcotic analgesic, and it requires a little intravenous into your hand as well, and you would press a button and that would deliver straight into your bloodstream a shot of remifentanil. So that's again a lot stronger than morphine injection in your leg. It's not hanging around as long, it's only around for about 7 minutes. And then probably the most complicated but the best analgesic is Epidural, because it's local anaesthetic, basically from waist down. It doesn't affect your baby, but it does certainly affect the mechanisms of your labour. So we've got a link to one of our anaesthetists giving a talk about Epidural that I'll refer you to for that. But in a nutshell, it's a combination of local anaesthetic going into a spinal space and just really numbing that area. And when they work well, they're really good, and you can still move your legs, but sometimes they're quite heavy. But I'll let the anaesthetist explain that on your link. So just to recap, some people will go through their labour just using these things. Some people will go through their labour maybe doing some of these things and maybe 1 or 2 of these things. And some people might just decide to go straight for an epidural. Everyone's different.